bad.
What's up? Another episode of Ripple Effect Podcast. I'm your host, Rick Othervines, also known as Ricky Verans, and a great and important episode for you today. Just like the Union of Unwanted, I truly believe the Ripple Effect Podcast has been putting out very important episodes, very important discussions with people who are doing amazing work, and hopefully exposing you guys to some really interesting thinkers, conversations, creators, and today is no different. Luckily, throughout the years, I've kind of created a network. I've gained some respect in the community where people will send me suggestions for possible guests on my show. And of course, I get those suggestions sometimes from fans and listeners of the show, but I also get a lot of those from other guests that have been on the show. I love to have this privilege to help promote people who I think are doing important work and help them network with other people in the community. You guys have seen me do it with the Union of Unwanted. I'll have somebody on my show and I'll feel like it's a really powerful conversation, and then I'll bring them to the Union of Unwanted to help expose their work to more people, and then also maybe give them some contact information and get them on other shows. So to me it's really important to just get the conversations out there, expose anybody who's doing great work as much as possible, expose them to as many people as possible. So hopefully you guys feel the same way about my show, about the Ripple Effect Podcast, and also my show on Rockfin, Ricky Rants on Rockfin, and I'll get to Rockfin in a second because there's a lot to discuss about that. But hopefully you guys feel like this show is important. You can see the importance in it in regards to the type of guests I have on and the quality of guests I have on, and hopefully also exposing you guys to new people you haven't heard before. So if you do feel that way, please support the podcast. I have a Patreon page. As you know, I have a merch store, the Ripple Effect Podcast merch.com. I have a PayPal account, which you'll find in the show description. All these things you'll find in the show description. So there's plenty of different ways to support the show. Or if you can't financially support the show, that's okay. Share the show, review the show, rate the show. Even though I'm sure the algorithms are not working in my favor, all these things do help. It takes a little bit of time, and it goes a long way. And hopefully, if you can't help the show financially, hopefully someone who gets exposed to the show can. I know I say it all the time about how I truly believe in doing this full time, and I feel like today's show is really another example on why I have such an urge to do this full time. Let's get into who today's guest is and how I got connected with him. Dr. Lyons-Weiler, also known as Dr. Jack, host of Unbreaking Science and a past guest on the Union of Unwanted and on my show, the Ripple Effect Podcast, connected me with Dr. Joel S. Hirschhorn, and he is the author of a great book I highly recommend you guys checking out called Epidemic, Blunder, and I'll put links to his book in the show description. It's inexpensive. If you have a Kindle, you can get it on Amazon, I believe, for free or at least really cheap, and it's easy to read and really exposes Dr. Fauci, and I'm sure a lot of people who listen to the show are very skeptical and are pretty knowledgeable about who Dr. Fauci is, but we go much deeper in today's episode, so you guys are really going to enjoy this. Now, I did mention Patreon. I recently did a Patreon podcast with my fans, which I try to do once a month. I called Ricky Rants with Fans, and if you support me on Patreon, once a month I do an episode, and I invite my fans from Patreon, and we chat, we connect with one another, and we connect with other listeners of the show. So they're always really fun. I always enjoy them. I know Patreon people are getting a little worried that I'm next on the list of people getting banned off Patreon. A lot of people that I know, like Whitney Webb and Ryan from Last American Vagabond, are getting kicked off. James Corbett recently started having issues with Patreon. So with that said, I'm going to stay on there as long as I can. I don't post content on there. neither was James Corbett, and he's having issues with them. So it's probably a matter of time before I have issues with them. But as long as I can be on there, I will. It's easy. It's convenient. I don't have to touch it now that it's set up. And if you're supporting other content creators on there, it's super easy to also support me. But I know that I have to look at alternatives. And that's why I do have a PayPal account. I do have a merch store. And I have exclusive content on Rockfin. So if you guys aren't familiar with Rockfin, a lot of people are on Rockfin. Jimmy Dore, Last American Vagabond, Whitney Webb, Jason Burmis, Sam Tripoli, Charlie Robson, Truthzilla, and I'm sure I'm forgetting tons and tons of great content creators that are on there. Lee Camp's on there. So many past guests on my show and people that I'm sure you're a fan of are on Rockfin. And if you pay the monthly fee, whatever it is, I don't know. I know it's under $10. I don't know if it's $9.99, $5.99, whatever it is. You get access to everybody's content. But most people also have free content. So if you create a free account, you can see everybody's free content. But when you're on Rockfin, you can subscribe to people's channels. You can tip them. You can send them money. You can watch their videos. And just watching their videos and subscribing to them and following them helps them monetize their content. So you pay that one monthly fee, and just by watching people's content, just by subscribing to their channel, you're helping them, and you don't have to pay any more if you don't want to. You can tip them, like I said, if you would like. So it's a great way of supporting content creators, and it's just one more place you can do that. So, I have PayPal, and like I said, all this stuff will be in the show description. I have PayPal. I have a Patreon page for the time being. I have a merch store, the Ripple Effect Podcast, merch.com. The Ripple Effect Podcast, this show is available everywhere. And I want to keep it that way. But as censorship keeps getting worse, the more and more places I have the Ripple Effect Podcast, the better. So what I'm going to do is I'm already in conversations with Matt from Content Safe and Rockfin in regards to getting my whole archives of the Ripple Effect Podcast on Rockfin. And what I'll do, I'll keep it free there. It'll be on my channel, rockfin.com/Ripple Effect. And I'll put that also in the show description. And it'll be on my channel. You can watch all my Ripple Effect Podcast episodes for free. And then if you want, you can also see my premium stuff, Ricky Rants on Rockfin. So you have two options. If you have a premium account, you can watch all my stuff, including my exclusive show just for Rockfin called Ricky Rants on Rockfin. And you'll get to see the Ripple Effect Podcast. And if you have a free account, you can just use Rockfin as an alternative to YouTube. They are, and I'm announcing this, we've been pushing for this and asking for this for a long time. I hear that we're not that far from a Rockfin Android app, so look forward to that. But it really isn't hard to just go to rockfin.com/Ripple Effect, or just go to rockfin.com and log in and just watch and listen to all the content just on a web browser. So you have all those options. With that said, I think that's enough. That's enough announcements. Hopefully very soon I'll have all my Ripple Effect Podcast stuff on Rockfin, so you can watch that there instead of YouTube. If you're boycotting YouTube, you can also support me on Rockfin if you're boycotting Patreon, and I don't blame any of you guys for doing those things. And as more alternatives pop up and more alternatives to things like PayPal and Patreon and YouTube, all these platforms that are censoring us pop up, I'll continue to explore them and hopefully use them if they're good. So that's it, guys. Enjoy this very important conversation, and I'll talk to you guys on the next time. How are you?
Hello there. I hope I'm coming through.
Yeah, I hear you good. You hear me well?
Yes,
Awesome. Thanks for being with me. I really appreciate it.
I'm very happy to be with you.
That's the nice thing about being in the alternative media community is that a lot of us help each other out in regards to, like, hey, there's this great guest, this great author, this great researcher, like, check them out. We can help promote them. So I'm really excited to have you on. And I honestly just got exposed to your work by a past guest of mine and a mutual friend of ours, Dr. James Lyons-Weiler. And I saw your interview with him, and it was an awesome interview. And it's a topic that I haven't done a whole show focused specifically on, like especially like in regards to Dr. Fauci, because a lot of people see him as like a saint and this great guy, and and obviously, like, I think a lot of that is political. You know, it's one of those things where people who dislike the president, dislike Donald Trump, they saw that there was some friction between Fauci and Trump. So they're like, hey, you know, if we have the same enemy, then we're friends, you know, so
Right.
let's root for this guy. And so I think a lot of it was much more political than anything else. But let's get right into like maybe your background before we get into your book and some of those specific details. How did you get into this research, and what's some of your background?
Well, I got into it about a year ago, obviously, when the pandemic hit. Um, I have a long history of working on health and medical issues. When I was a professor years ago at the University of Wisconsin, I directed a research program between the School of Medicine and the College of Engineering. So it was medical research. Did that for a number of years. Published a lot, had a lot of financial support. Moved on to from the academic world, which I was very successful. I was a full professor, tenured professor, but I wanted to work on public policy issues. So I went to the Congressional Office of Technology Assessment, which was one of the four support agencies for the U.S. Congress, and became a senior official there and directed a lot of work, again involving health issues, mostly around things like toxic waste sites and people being exposed to toxic chemicals and all kinds of health effects from that. And then eventually I also went on to become a senior official at the National Governors Association, where again I got involved with work that involved the negative health impacts of suburban sprawl. and and then after I retired, I became active and still work in a Johns Hopkins hospital as a what they call an executive volunteer, working with the management of the hospital to improve things. So I've been very involved with Johns Hopkins system for about over 10 years now. I'm not an MD, but I am a PhD. I do belong to two medical uh, societies or groups that I'm proud to belong to, because these were the two groups that have promoted what I eventually became enamored with. And these were the Frontline Doctors Group and the Association of American Physicians and Surgeons. Both of these groups are mostly physicians, but there are people like me, PhDs, with a lot of background in medical research or dealing with medical issues that are in these groups also. So I just got heavily involved, and I started to write articles back in I guess the summer of last year, 2020. And there, I started to write articles because I was doing a lot of research. I read the scientific literature. I read the medical literature. So I can go to the medical journals, and I have enough of a background in education to be able to read scientific and medical journals, published papers. And I quickly learned a lot and started to write articles about what was missing from the whole strategy by the US government to deal with the pandemic. And the more I researched, the more I wrote. And I wrote a fairly large number of articles that got published on a very large number of websites. And I think I've reached hundreds of thousands of people through those articles. And eventually I said to myself, well, I have done all this research, I've done all these articles. I think I can put together fairly quickly a very relevant, timely book. And so I got the idea. Although I already had been an author of a number of nonfiction books, and I thought I was too old to do another book, but I felt so compelled because I think the American public was really being screwed, let's say, by a very corrupt, misguided government system that was not protecting Americans, and that was proven. by the high death rate and the high rates of hospitalization. And all of my research was showing that there was a viable alternative to what the government was promoting. And in my book, I present the very, my book is written, by the way, for common, ordinary people. It's not written for the medical world particularly. It's written for ordinary Americans. And what do I explain initially in my book is that what I call 4 pillars of sort of pandemic management. The first pillar, the highest priority, is what we call early home treatment and prevention. Action for people at home or outpatients through their doctors. The second pillar was contagion control. And that's where you got into masking and lockdowns and school closings. And that should have been, at best, the second priority. And then the third priority, pillar 3, was taking care of people in hospitals. Of course, the idea of my first pillar was not getting people into hospitals. And then the fourth pillar, as explained in the book, is vaccines, basically. So the thesis of my book is very simple, is that the government, led by Dr. Fauci, had wrongly sort of skipped over the first priority of taking early action. And I have an interesting discussion at the beginning of my book, which is, I think, just purely educational, is that if you look at the entire history of medicine, I'm going back not years, not decades, but hundreds of years, what we have learned in the history of medicine is that all good physicians of any kind should always take the earliest possible action to deal with any illness and any disease. Early initial action. You stem as best you can, physicians have to act quickly to stem any illness or disease. Now, you would have thought rationally, as I did, that would have been the sort of strategic priority of the government when they were hit with the pandemic. So what I quickly learned in my own personal research, going back again about a year, was that there were a few courageous, innovative doctors in the US, but particularly a couple in France. But we had some doctors, and this is amazing for people. When I tell people this, they can hardly believe this. But a year ago, in March of 2020, we already had some American doctors giving their patients some generic medicines and supplements that would knock out, actually, these are people, patients who had serious symptoms of the coronavirus, okay? They had the symptoms. Some of them had positive test results, and many of them were very elderly. Dr. Zelenko, who wrote the foreword for my book, was truly one of the great pioneers. He was still in New York, and he was giving his elderly, mostly elderly patients, a protocol which he had learned to use, again, based on the research in France. And it was a protocol that was using hydroxychloroquine, and quickly learned that you also had to give zinc with this, and then pretty quickly learned that you needed also to give vitamin D with this. And so this became an initial protocol, and not only was picked up and developed by Zelenko, but a handful of doctors around the country. I work with George Fareed in California, a great doctor and epidemiologist, Harvey Reich in Yale University, and a great doctor in Texas, Peter McCullough. So we had some of these courageous doctors, and you have to realize they were going against the tide of what the government was doing. And the government was not promoting this early action by physicians to give the best healthcare to their patients. And it involved keeping people out of the hospital. And the data that came from Zelenko and these other early pioneering doctors was that they were cutting hospitalizations by a huge percent. And they were basically eliminating deaths. There was virtually no deaths with these people that had got the COVID disease and virus. So this was an amazing story to me. But the more amazing side of the story is that the government actually officially blocked the use of these protocols that these doctors were successfully using. And by the way, just as a little piece of historic information, several of these doctors somehow got to inform President Trump in the White House of their early, I'm going back again to March a year ago, that they had a way of treating COVID that was extremely successful. And that's why Trump took hydroxychloroquine, because he actually listened to these pioneering doctors who had the initial evidence that what they were doing was working and working very, very well. Unfortunately, the historic lesson here, as soon as Trump unfortunately went public with the fact that he was taking hydroxychloroquine, at that time, there was an enormous anti-Trump movement, particularly in what we call the mainstream media, which I call the leftist media, anti-Trump media. And as soon as he went public with science-based use of hydroxychloroquine, the national press, the press everywhere, basically launched a campaign against hydroxychloroquine, unfortunately. And that was led by Dr. Fauci, because people have to understand, of the three critical federal agencies that deal with this pandemic, the National Institutes of Health, the FDA, Food and Drug Administration, and CDC, Centers for Disease Prevention and Control, that Fauci is the power behind the throne, always was. And the anti-Trump movement elevated Fauci to, again, this godlike, infallible status, as if he was a great public health official. And I always like to tell people, just this is, again, a piece of solid information and insight. Fauci never was and still is not a public health official. He was not trained as a public health official. He was always a researcher. NIH is a research institution. FDA is a regulatory agency. The only federal public health agency is CDC. But most public health in the United States is at the local and state level. Every state government, virtually every local government has a public health department. And public health is a discipline. And we have people who study public health in universities, lots of professors who teach and research public health. But the subtitle of my book, Pandemic Blunder, the subtitle is Fauci and Public Health Blocked Early Home COVID Treatment. And that's sort of the thesis of my book, is this enormous failure of the government to use what I call Pillar 1, act quickly and keep people out of the hospital. Instead, what was Fauci doing in the spring and the summer last year? They were promoting expensive medicines for use in hospitals. They were not working to keep people out of hospitals. Doctors Zelenko and Fareed and all these other great doctors that I've worked with, their intention was to keep Americans out of the hospital. and the medical community was missing that because the government was missing that and blocking that first pillar of early action with available generic drugs. And first it was hydroxychloroquine, a cheap generic used by probably billions of people over many, many, many decades, because it was used for dealing with malaria. It is a proven safe drug. And then later in 2020, another generic drug came along, which again, smart doctors found it worked, and that was, it's called Ivamectin. And now Ivamectin, because of the political baggage of hydroxychloroquine, Ivamectin has been used by many doctors. And all these doctors that I'm talking about, the good doctors, you have to, are swimming against the tide, are going against the grain, are going against not only what the government says they shouldn't be doing, but with all the major medical societies, the American Medical Association, also say, hey, all the doctors shouldn't be using all of these pillar one approaches, early home treatment and prevention. I want to emphasize that the things that I'm talking about, the use of hydroxy and ivermectin and vitamin D and vitamin C, not only can cure COVID if they're given early, and I have to emphasize that they have to be given, and this is science-based, and the French unveiled this truth also. These protocols had to be given within the first 3, 5, at most 7 days of when a person got the serious symptoms of COVID, or they got a positive test. They only work if given very early in the game. And when they're given early, they shut down, the way it works, it shuts down the replication of the virus within the body, knocks it out. And I can talk a lot about vaccines not doing what I'm talking about, these early home treatment prevention protocols do. And if you want, I can talk about the fact that vaccines that we have now don't really knock out the virus from the body. What they're doing at best is preventing serious illness and death. But the virus is still in the people. And people who take these vaccines can still transmit the virus, okay? And what I want to do is get people to understand the alternative to taking the vaccines is seeing this pillar one option of having doctors, and you do need prescriptions for hydroxychloroquine and ivermectin. So you need doctors cooperating and giving you one of these many protocols that we have now. And that's an alternative to vaccines. And I am saying now, quite publicly, anyone who will listen, that probably most Americans don't need to take the vaccine for a lot of good scientific reasons. That is, they either have natural immunity, we see that in children particularly, that have never been exposed to the virus, or people, the estimates now that at least 50 million Americans actually got the virus with no serious ill effects, no hospitalization, no death, but they develop natural immunity. So we have a huge percent of the population, and particularly young people who don't have what's called comorbidities. We have a huge fraction of the population that probably don't need to take the vaccines. Now there are people, and I'm going to be honest, I have taken the vaccine. Why have I taken it? And by the way, we should always call these vaccines experimental. And I can explain, if you want, why they're experimental, because they haven't gone through the kind of full testing that new medicines have to go through to get approved by the government. So they're experimental. But people like me, I have a serious heart condition. I'm 81. So there are older people that when you look at risk-benefit kind of analysis, yeah, we probably need to take the vaccine just to play safe. By the way, I still take twice a day one of the protocols that I described in my book. The last chapter in my book is to help people develop their own strategy to stay safe and healthy. And there's a great protocol just based on no generic prescription medicine. It's just based on taking zinc and a supplement called quercetin, a lot of vitamin D, and a lot of vitamin C. I still take that every day, twice a day, okay? Even though I've had the vaccine, because I think these protocols really work in terms of prevention. So that's sort of a big picture. I can talk a lot more about the corruption. Why did the government, why did the public health system not promote early action by physicians? And what they did, they destroyed what we call medical freedom, the freedom of physicians to use their best judgment to give their patients a good treatment for an illness or disease. The government stood in the way, still stands in the way, by the way, officially of physicians doing this. So when I say there are pioneering and innovative physicians starting last March, statistically, these are relatively few physicians in the United States. The vast majority of physicians still are blocked by what the government has said and done, from prescribing hydroxy or ivermectin and helping their patients with these protocols. They're still not doing it. So why do we have 500, I think it's now 530,000 people have died, they say, from COVID. And by the way, since Biden became president, that was another 120, 130,000 people have died just in the short time since Biden had become president. So this death rate, why so many people died? What I say in my book and in any public thing I can get access to is that way over 300,000 COVID deaths could have been prevented if the government had allowed US physicians to use these protocols developed by Dr. Zelenko and others. What I say officially in my book at the end, 70 to 80% of COVID deaths could and still can be prevented, by the way. The latest headline in a story about ivermectin, which is another drug that's been around for a long, long time, used for other purposes. And I found it interesting that the headline of the story on ivermectin was, it prevented 75% of deaths. So my range of 70 to 80% has been vindicated once again by some newer research on ivermectin.
Yeah, there's a few things that you discuss. I mean, Kerry Mullins, the guy who is responsible for the PCR test, has very much the same opinion on Dr. Fauci as you. You know, he's on video talking about Dr. Fauci. You've said it in interviews, and I agree with you 100%. I mean, can this guy even have any free time to look at research and keep up with stuff? I mean, he's a celebrity. He's doing interviews every other day.
Every day.
Yeah, he's constantly on every show. He's on doing interviews. I mean, this guy is just a PR guy, and yet everybody goes to him and people like Bill Gates for information, and it's like their opinions are gold. And yet there's so many doctors that are being suppressed. And many of them I've had on my podcast. You know, I've had Dr. Scott Jensen on. That was one of the guys referring to the new CDC guidelines for death certificates in reference to the COVID deaths and how they're kind of giving you a lot of wiggle room for those. Dr. Carrie Madej, Dr. Northrup, Dr. Kendra Becker. I mean, there's so many doctors out there who are questioning things and going against the grain, but those voices are suppressed. And like I always say on this show, until 2020, prior to 2020, it was quite acceptable to have doctors that disagree with one another. You'd go to a doctor that give you a opinion based on what they saw and the information. You can go get a second opinion. You can go get a third opinion. Nobody was demonized as pseudoscience or spreading misinformation. But now, if you have a doctor that disagrees with Dr. Fauci, then they're pseudoscience or misinformation. They're spreading disinformation. And initially, right off the bat, it was quite obvious that there was other things going on because, like you said, I've always been into health and nutrition. I'm a big fan of taking care of your body first. Your best defense against anything is a healthy immune system and a healthy body. And there was no advice about this. There's all they would focus on are numbers and statistics that would continue to spread fear. It was all about, initially, it was all about deaths. Even the first deaths in the U.S., when they were all in one state, Washington State, and actually the majority of them were all in one nursing home, they never gave you that information. They just told you, oh, there's this many deaths, and they never told you it was nursing homes. They didn't tell you the average age of people. They didn't tell you any of the stuff that would actually reassure you that maybe this isn't as bad as they're selling it. And then you look at like a Event 201 and you look at Bill Gates talking about a possible virus outbreak. You to look at Dr. Fauci, talking about a possible virus outbreak prior to 2020, and then yet everybody acts like, oh, we couldn't have prepared for this. It's like, well, how could you have not been better prepared? I mean, you were part of research, you were part of discussing these things prior to 2020. So it seemed like there was other agendas being pushed, and a lot of this, like you said, became political. I mean, hydroxychloroquine. I'm very anti big pharma in regards to, like, look at foods, look at exercise, look at vitamin D, look at those things first. But in regards to hydroxychloroquine, that became political, and to me, I wasn't pro hydroxychloroquine. I could just see what was going on. The fact that they were pushing it, or they were demonizing it because they wanted to push a more expensive alternative. They didn't want the generic drug that's been around forever. And then anybody who said, oh, there's been studies that showed that there's side effects. Well, have you ever seen a pharmaceutical commercial? There's every pharmaceutical drug has loads of side effects. I
Right,
mean, so
right.
you stating that there's side effects for this drug doesn't I mean, that's not relevant, because I mean, every drug that's on the market has possible side effects. I mean, peanut butter has possible side effects. I mean, it doesn't mean that you should demonize peanut butter. So it's just it's one of those things that it was obvious that it became a political thing, and all the anti-Trump people, instead of seeing what big pharma was doing, they cared more about just pushing their narrative, and telling people that Trump was a evil person, bad person. He wasn't taking it seriously enough, and it's a shame, because so many people let their dislike of Donald Trump get in the way of logic, and get in the way of seeing that this wasn't about the president. This was about big pharma. This was about spreading fear, and this was about all these other agendas. And so, yeah, I mean, without a doubt, people became very tribal, and they didn't. All these things, like you were saying about your immune system. I mean, the vitamin D deficiency. I mean, a lot of these cases with minority groups. I live in East Coast. I live in Massachusetts, and we have tons of vitamin D deficient people, and there was a correlation between vitamin D deficient people and people who were having a worse impact, or worse time dealing with the virus. What does that tell you? I mean, why isn't that information being spread throughout the news? Why isn't that information being discussed nonstop? It's always about the vaccine, the vaccine, the vaccine. And like you said, what people don't understand is that there are other alternatives. It's not your only option, and these vaccines aren't FDA approved like other drugs are, because they got to be fast tracked and skip all these these extra steps to try to get it out quicker, because we're in a state of emergency. Like you said, it's considered a experimental vaccine. Now, I had Del Bigtree say that hydroxychloroquine, and I've repeated this actually, and I believe that it's true, but maybe you know more about it, that one of the other reasons why possibly hydroxychloroquine was demonized was because if there was any alternative treatments, or any treatments whatsoever, that they would have a tougher time fast tracking a vaccine. So they had to
That's
almost.
true.
That is true.
It is true. There is a legal aspect to this. And so when they give this kind of temporary approval to a vaccine, it is based that there's no other viable options out there. And that's, from the very beginning, and I would use the word suppression, that the media has suppressed all of this positive information about the things that I'm talking about in terms of early home treatment and prevention. My book, I'll hold it up here for a moment. My book is loaded with data because I have a data background. Okay, so the book is filled with data from the US and other countries showing that all of these protocols actually work. And when you look at data from other countries that have really lower death rates from COVID, and the data's in the book, and the data's available on websites, the reason they have much lower death rates and hospitalization rates is because they are using hydroxychloroquine or ivermectin. So we have this science. People talk about following the science. Well, the greatest scandal in this whole story of the pandemic is that Fauci has never followed the science, okay? And I want to give you an insight about how Fauci controls the system. NIH gets a huge budget, billions and billions of dollars. Fauci has perhaps the largest institute within NIH. Fauci gives out every year something like $3 or $4 billion to medical researchers, academics, all kinds of people in the medical community. When you're giving out billions of dollars, you are controlling that part, a huge part of the medical community. Believe me, there are many physicians, epidemiologists who live off of this money from Fauci and NIH. So not only does he have a kind of political power, he has a fiscal power, a money power that he has used very amazingly, actually, to actually feed this suppression of all the good news that we have, other than contagion controls and lockdowns don't work. Masking, I think the science has shown, also doesn't work. You know, the one message in my book is what we call contagion controls, which is the second pillar, which should not have been the first priority of the government. But the government wanted people, the politicians, wanted to promote fear so that they could exercise their power. And how do you exercise power in a pandemic? It is through contagion controls, and now it is through promoting vaccines. And again, I have some data in my book, some information at the end of the book about the uncertainties about these vaccines. Again, it may not get the virus out of your body. People who get the vaccine may still spread the virus. And again, more importantly, as many other scientists have found and concluded, a lot of people don't need the vaccine. You know, why are we? Now, you hit it when you said it briefly, and let me amplify. It is all about the money. It has always followed the money. I point out in my book, Fauci has a long history of working with big drug companies. He has been doing this for many decades. Just as he worked with the communist Chinese government, he funded the Wuhan lab where the virus probably came from. He has been a big proponent of the World Health Organization, which is a total failure in terms of what they've done with this pandemic. So when you look at Fauci's history, again, by the way, NIH gets money from these vaccines, okay? There's a whole complicated system because they share in the patents for a lot of these vaccines. NIH, and particularly Fauci's group, and individuals will be getting money forever because billions and billions of dollars will be spent on vaccines, not only in the US, but around the world. So it is all about the money, okay? If Fauci would have been promoting what I call Pillar 1, early home action by physicians, there was no money to be made by big drug companies. Hydroxychloroquine costs pennies. Ivamectin is a cheap generic drug. Now you need prescriptions, but there are ways of getting them. I got both by getting them from China, okay? And there are still doctors, and I give websites in my book where individuals can go to websites and get in contact with US doctors who will prescribe them things like hydroxychloroquine or ivermectin if they choose that. Okay, so there are ways of getting these medicines. And you know, one thing that what happened early on in the Trump administration was they created the stockpile. You may know about this. There is a federal stockpile, huge amount of hydroxychloroquine, which has never been used. Okay, and that's, you know, one of the organizations I belong to, Association of American Physicians and Surgeons, spent a lot of money on a legal battle to unlock the federal stockpile of hydroxychloroquine to let physicians get access to all of this hydroxychloroquine. And the lawsuit did not succeed, okay? So that the government really has fought all the alternatives to expensive drugs. Fauci pushed a drug called remdesivir, which can only be given in hospitals, costs many thousands of dollars, and really doesn't even work that well. And again, he allowed them not to follow the normal clinical trial procedure, so that also got approved for use in hospitals. But the push for vaccines and expensive drugs, yeah, it's all about money. It's all about the drug industry that Fauci has had a very close relationship with for decades.
Well, I think you said in an interview, isn't Fauci one of like the highest paid government officials?
He is
He is the
higher than the president. He is
It's crazy.
not only is the much above what the president gets. Okay, it's much above 400,000 a year. He also gets these other. He got five. I point out in my book, he got a prize of $500,000 from some entity in the U.S. And a few weeks ago, he got $1 million from an entity in Israel. Okay, so and you can imagine that when he finally gets the hell out of government, he'll get a book contract and make, again, many millions of dollars with a book. Okay, so
He's making money
yes,
selling shirts. I see celebrities with like Fauci shirts, and I'm like, what is going on here? I'm like, this guy, again, everything became so political, and people's lives were being sacrificed for political reasons. I mean, you look at Cuomo in New York. The fact that you demonize hydroxychloroquine for political reasons, and I give Trump a lot of credit, because I don't think any other president would have had the balls to come out and just say, you know what, this hydroxychloroquine I've been telling people has some positive effects. I'm on it. So screw all you guys who think that it's dangerous and I'm promoting a dangerous drug. I told people, I'm like, do you think that the doctors of the president would give him a drug that could potentially harm him? I mean, imagine having that on your resume. Like, it's obviously it was because they truly believed that it has some success, and it wasn't promoted because it was a generic cheap drug that's been around for many years, and essential, one of the many essential drugs that are commonly prescribed. So and then when Cuomo made it illegal to for doctors to prescribe hydroxychloroquine, when that is the most outrageous thing ever. I mean, that should be a decision between a doctor and their patient. The fact that a politician gets involved and makes a medical decision like that, but yet actual doctors are getting kicked off YouTube for discussing things, and yet Cuomo can make a medical decision like that. I mean, that's outrageous.
It is. And again, I want to emphasize that Trump took the hydroxy because there were, I think, 3 doctors that had somehow gotten access to the White House and showed the White House doctors and Trump the data. They had Zelenko and Smith in New Jersey. These guys, these physicians, had the data, okay, showing that it worked. And then any doctor who did the research in about 10 minutes would find out that hydroxy was a totally safe drug used, and by the way, around the world, hydroxychloroquine and ivermectin are over the counter. And that's why in so many of these countries around the world, there have been very low death rates from COVID. And when you dig into it, some of it has to do with vitamin D and where these people live, and they have a lot of high levels of vitamin D because they live in, southern hemisphere where there's a lot of sunlight. But some of it, a lot of it, has to do with the fact that governments around the world, including India and lots of other countries, have just made hydroxy and ivermectin easily available. Basically, in many countries, they give it out free, okay? So even in South America, some countries doing wonderful things, and all of this information is in my book. What other countries have done, so contrary, that's the point, so contrary to what the United States has done. In fact, it's amazing, again, unfortunately, other Western countries are doing, have done what the United States has done, and that's sad. So that's why you see, bad death rates in the UK and other places in Europe, particularly Italy, because they didn't pursue what I'm talking about in terms of what we call early home treatment and prevention, okay? But other countries around the world did, and that data is absolutely amazing. And one of the stories in my book is that it's an amazing story. Switzerland at first made hydroxy readily available, and their death rate was very low from COVID. And for reasons which are difficult to get into, they all of a sudden legally stopped the use of hydroxy. And what happened? Almost immediately, within days and weeks, the death rate from COVID skyrocketed in Switzerland. So then what did they do? They had enough good sense to say, we made a mistake and we're going to reverse our political decision. And now we're going to unleash the use of hydroxychloroquine. And what happened? We have the data. The death rates dropped once again from COVID. So that's an interesting experiment, so to speak. It wasn't designed to be an experiment, but it turned out to be an experiment at a national level that showed that you could reduce the death rate if you promoted the use of hydroxychloroquine. And again, it has to be used with zinc to really be effective. I want to emphasize that. And it has to be given early. And the reason why the press, you might remember in the summer last year, with the anti-Trump movement going against hydroxy, all of a sudden, the press was talking about studies, published papers that were showing hydroxy did not work or caused harm. And I can tell you that this is totally phony stuff. That, in fact, two of those famous papers had to be withdrawn from two of the biggest medical journals in the world, okay, because they were phony papers. And most of all that research with negative results about hydroxy were terrible studies. They either gave the hydroxy without zinc or they gave it too late. These were given to people already in the hospital with serious symptoms. And again, as I've told you, hydroxy with zinc only works when it's given very early. So when you start to do research on people in hospitals and trying to show whether hydroxy works, well, of course, you're going to get bad results. It's too late. And in some of those bad studies, they gave the high doses of hydroxy were basically lethal doses. So there were a lot of reasons, but the press played this up for many, many months. All they wanted to talk about was how hydroxy did not work. Whereas I'm sitting and all these other people are sitting on tons of data from all over the world saying hydroxy works. Dr. Zelenko, he was using it, still using it, by the way, to save people's lives, keeping people out of the hospital. And the statistics from Zelenko and others were phenomenal, but you never read about this in the mainstream press.
Yeah, and like that video I sent you that I actually had to send you from the odyssey.com website, another video platform that doesn't censor people, with Dr. Michael Yeadon, the ex-Pfizer employee. I highly recommend people watch that video and
Yes.
and don't search for information on YouTube, because you won't find much if you're looking for alternative perspectives. You have to go to a odyssey.com or BitChute, these other alternatives, which is why I put my podcast on all the platforms, because there's a very good chance they might not find it on YouTube. And you know, I've had a lot of controversial people on. I don't think are controversial. They're just people like yourself talking about actual science, talking about actual research and information. But YouTube seems to find it controversial. But yeah, I mean, he talked about how, you know, and this is something that a lot of people are aware of, that coronavirus has been around for a long time. It's not a new thing. It's on the Lysol can because it's been around, and it, you know, it says, Lysol says it kills coronavirus, because it's just one of those words that didn't really scare people until the media made it scare people. And it is one of the common viruses that give you the symptoms for a common cold. And when you get the common cold, and it's possible that you could have had some immunity to coronaviruses, which means you could have some type of immunity to, you know, the virus that to COVID-19 and really getting sick from this virus. So it's this specific coronavirus. So it's yeah, I mean, all this stuff is suppressed. It's perspectives that I think are important. It can help people, but it helps people in a way that nobody benefits financially. And like you said, usually you follow the money and you can get to the bottom of just about anything. And did you end up doing, and speaking of Dr. Fauci and following the money, I know Dr. Judy Mikovich. She's been on my other show that I host, the Union of Unwanted, and she's talked a lot about this. And I believe even Mickey Willis, who did the Plandemic documentary, he was on my show, and he talked about this, about the history of Dr. Fauci and the AIDS epidemic.
Yes.
Did you do research into that, and that, all of the corruption in regards to that?
Yes, and that's why I think it's interesting that although Fauci has been put on this pedestal and created like a god, he has a long history of screwing things up. So he screwed up in the AIDS situation. He held back a medicine for quite a while, and I think thousands and thousands of AIDS patients died because Fauci held up the medicine. And this has been well documented. One can go back and find the whole story about that. But even in this pandemic, you have to go back and remember that basically Fauci got almost everything wrong initially. I mean, he is a flip-flopper. So first he says masks don't work, and then he switches and says, oh, everyone has to wear a mask and you got to wear it all the time everywhere. Now, of course, the science has gone back to showing, research has shown, and I have some of this in my book also, research has shown that masking actually doesn't work very well. And it was always known not to work very well. And so Fauci has flip-flopped. He pushed lockdowns. And now there is all this wonderful research, and again, I have some of it in my book, that lockdowns don't work either. And this is, again, under the rubric of what we call contagion controls. Does masking work? No, probably not very well at all. It's not the solution. Do lockdowns work? Absolutely not. More people, and this is again some wonderful research out lately, showing that more people will probably die from health problems because they have not taken care of themselves. They have not gotten cancer screenings. They have not gone to their doctors enough. They just haven't gone to hospitals enough to take care of various medical problems. And then you have kids who are locked out of schools. You have high suicide rates, and they're not getting fed properly, many of them. So when you look at all the negative impacts of all aspects of lockdowns, you realize that more lives may probably, be destroyed because of also economic conditions. All the people put out of jobs and small businesses. So lockdowns don't work. And yet Fauci has had trouble. He doesn't follow the science. That's what's most amazing, that phrase, people have got to follow the science. One thing I've pointed out lately, when you look around the country and you see lately Texas and Louisiana, for example, basically opening up their states, okay? But you see this incredible diversity among states and local and state governments about what actions they're taking to deal with the pandemic. When you see the diversity of actions, then you've got to ask yourself, how can they be following the science? There's only one science. So if people were really following the science at every level of government, at every level of public health, then we wouldn't be seeing all of this diversity. And lately, there's all kinds of data showing that the states that have used less masking and less lockdowns, and you look at death rates and hospitalization rates, it's just as good as in those places that did not pursue strong lockdowns and masking requirements. So that's the science. And we have research from around the world, particularly in Europe, showing that so many of the actions that our politicians take, they are not following the science. So I find it amazing that phrase, follow the science. Well, people are not following the science. If you follow the science, then you'll buy into what I'm saying in my book and what some of the other people that you've mentioned I did look at a couple of videos you sent me, and I agree with those physicians, those experts also. Their view, bottom line is that a lot of people don't need to take the vaccine. We have a lot of immunity, natural immunity, and immunity. People estimate 50 million Americans at least did get some form of the virus, but they didn't get serious symptoms. They didn't go to the hospital, okay? But they did get immunity, okay? So this concept of herd immunity, there are some great doctors right now, some that I strongly agree with, from Stanford, particularly Stanford University, who say we've already pretty much reached herd immunity. But still, why are they pushing everyone getting the vaccines, even children? How can you justify giving these vaccines to children when the vaccines are truly experimental, have never been tested seriously on all sort of demographics? So it's a crazy situation. Again, we're dealing with a kind of insanity when we look at how our country has dealt with this pandemic. And if there are high levels of deaths, not all of those COVID deaths are legitimate. There was an old saying about prostate cancer for men. Most men die with prostate cancer, not from prostate cancer. And the same thing is true with a lot of deaths right now. People are dying with COVID in their body, but they're not dying necessarily from COVID. And that's an important distinction. Other than that, there's some crazy things going on. I have seen data from a couple of states where people who've been shot dead, gunshot dead, and died in accidents, motorcycle accidents or car accidents, and those people categorized as COVID deaths. Why has this happened? Always follow the money. The government created financial incentives for hospitals to declare deaths as COVID deaths. They get more money. If you're running a hospital and you want more revenue, then you want your people to classify as many deaths as possible as COVID, because the government will give you more money.
Yeah, and the thing about science is that there is a lot of corruption in it. I mean, just last night, I couldn't sleep last night, and I was going down a rabbit hole of the cholesterol myth. And there's this Australian journalist that did a good special on it, and I think you could still find it on YouTube. It's called The Cholesterol Myth: The Heart of the Matter. And it's you go into that and you see all the shady science in that, and you see all the shady science in this, and then anytime there's shady science, you find out, okay, why is there this manipulated science or this biased science? Oh, okay, somebody's making money off this. You're pushing pills, you're doing this, you're doing that. And so, even science is one of those things where people I mean, some science is subjective. I mean, but you can go online. Most science is subjective. I mean, you can go online, you can find conflicting information on just about anything. This study proves this, and then this study proves that study is wrong. And James Corbett, who's a friend of my show and has been on a bunch, he did a great short documentary called "The Crisis of Science," I like a year ago, and he was showing how easy it was to get things peer reviewed, and how often a lot of studies can't be recreated, so they get peer reviewed and they can't even be recreated. So there's a lot of, like, people like to believe that, like, oh yeah, just trust the science. But what you're really saying is, like, trust the science that I believe in. If there's any conflicting science, just ignore that one, and you referred to some of the studies that were published, like the Lancet study, referring to hydroxychloroquine and stuff like that. I mean, this stuff, a lot of times things will get published and they'll get redacted and then published, and a lot of times nobody really sticks to the story to find out that maybe a study that wasn't or was considered bad eventually was proven not to be bad, or vice versa. So people will just use headlines to kind of basically manipulate the public, like, hey, look at this study shows that this is bad. And then people will be like, yeah, see, it's bad. Let me share it. And let me share it on social media. And come to find out there's studies that say the opposite, So it's big tech and censorship has become a huge issue in
Yes.
alternative. I mean, it's been a huge issue in alternative media, but it's been fast tracked, for lack of a better term, and it's been just getting so much worse. Because now, if people want to get information from alternative sources, if people want to get perspectives from alternative doctors and all these people, like, all you find are debunking videos and videos from mainstream media, which are influenced by big pharma. I tell people all the time, I'm like, I challenge people to watch any of the major news stations during the commercial breaks, and in 5 minutes, you'll see multiple commercials, big pharma commercials. So that means that big pharma is paying the salary of the people who are supposed to be giving you news. What does that tell you? They have an influence on the news. Just like during the pill epidemic in the U.S., no politician would touch the topic. It was a real epidemic that was killing young people, and yet it wasn't treated like anywhere near what this virus is treated like, even though, like I said, it was actually lethal and killing young people. Young people were dying of pill overdoses. People knew that big pharma was purposely pushing these pills, knowing that people were dying from the overuse of it, and nobody cared. So yeah, I mean, this is a huge issue. Now, one thing I do find interesting, Joel, is that you seem like, if you didn't tell me you took the vaccine, and we had the exact same discussion minus a little part of the discussion that you said you took the vaccine, I wouldn't believe that I wouldn't assume that you took the vaccine, because it seems like like you were saying, it's experimental. It got to kind of skip some steps in that whole FDA approval process. Why do you think you took that route instead of just, like, I guess, putting your faith in just increasing the strength of your immune system and maybe some other alternatives?
Yeah, it was a difficult decision, but I think I'm in a part of the population. I think when you talk about people who are elderly with very serious health conditions, okay? Like, I have a very serious heart condition. When you talk about people in their 70s and 80s and 90s or whatever, then I think it becomes, well, it can be a rational choice, and you may have some reservations about it. But again, I think that's a minority of the population. Even people who are in their 80s and 90s in nursing homes, what some of the research has shown, they had natural immunity, okay? Not all of the people in nursing homes died. A lot of them did die, unfortunately, very sad. But, I had to, question my own sanity and my own science of knowledge. But I decided, well, I'll take the risk, because if in some bizarre way I got hit with the COVID and my own taking of supplements and everything somehow failed me, I'd be one of those people that would face death, essentially. But again, I'm saying taking the vaccine is a rational decision for a relatively small part of the population. I think it is being overly sold, overly pushed. I think it's and I follow survey data pretty closely, and it looks like at least 40 or 50% of Americans are right now unwilling to take the vaccine. I think that's a rational choice, a rational decision, also based on good science. They don't need the vaccine. People in their 20s, 30s, 40s, 50s, again, relatively healthy people, many of them with natural immunity, or they got exposed to the virus and now they have even better immunity, okay? So the mistake that we have right now by the government, by big pharma, as you have noted, is there's so many billions and billions of dollars to be made. What are they talking about now? Not just producing these millions of doses for Americans. Now they're talking about billions and billions of doses to give it all over the world. Well, there's a whole big fraction of the global population. They also don't need the vaccine. They have either natural immunity, high vitamin D levels, whatever, or they're getting all of these generic drugs free from the government. Why do they need to take? But you see, Big Pharma is pushing now, making billions and billions of doses of the vaccine, giving it, and what do you have? Some of these most awful people like Bill Gates, okay? I have a very negative view of Bill Gates. You know, people like him, what I call the globalists. And you got to remember, Fauci is a globalist, and Bill Gates is a globalist. Their views on the world, I can't buy into at all. And they're the ones, the globalists, are pushing, Big Pharma to make billions and billions of doses available to people all over the world. And the press is not giving any of the good news that so much of the global population, look at the death rates in many, many countries, India and many others, the death rates are not even significant. I mean, it's utterly amazing at times. You look at Japan, you look at a bunch of countries, death rates from COVID are very low, and they're probably more honest death rates than in the US. I think there's more honest reporting in many of these other countries. So why are we still pushing the vaccine? It only has to do with money. That's all, okay? And that's why what's aggravating to people like me and Dr. Zelenko and all these other great doctors is the US government is still, to this very day, through actions by NIH and FDA and CDC, still blocking the widespread use of ivermectin and hydroxychloroquine and these various protocols. Some of them have gotten much more developed and serious. Peter McCullough in Texas, who's a very famous physician, has published a great deal. And by the way, has used it on himself. What I love is the honesty. Peter McCullough said, I remember being involved with him on some sort of show. And, he said he got COVID because he's a practicing clinician. And what did he do? Well, he took hydroxy. I think he took ivermectin also. And now you have Dennis Prager, who I think is a very good conservative thinker, openly says he's still taking hydroxy. I think he's still taking and taking ivermectin. So we have some people, like Trump did, telling the truth of what they're doing. And even some of these physicians have taken and still take, by the way, these protocols, ivermectin and hydroxy. Even after they've gotten COVID, they're still taking these protocols that I'm talking about because they want to stay safe. And as a preventive measure, I want to sell prevention as much as cure. Yes, we know from Zelenko's work and the French work, yes, you can cure if you get COVID and it's serious. If you take the protocols within 3, 5, 7 days, you can knock it out of your system. But it's also about prevention. And that's where we see this competition, this conflict, because vaccines are being sold as a basis of prevention. So when you think prevention, you should also think about alternatives to vaccines, because they even admit, if you follow the research on the vaccines, people will still get COVID. People will still get COVID in their bodies. People will still spread COVID, okay? The vaccines don't seem to knock out the virus. What they do is mostly prevent you from the most dire impacts of having the COVID disease. So as prevention goes, people should feel that there is an alternative to vaccines. I'm not one of these people saying never take vaccines. I took the vaccine, I'm being honest. I think some people can make a rational choice to take the vaccine, but it's a relatively small percent of the population, okay? But as prevention goes, there is an alternative to vaccines. And people want to stay out of hospitals. I know we give a lot of praise to the nurses and doctors who work wonderfully in hospitals. Again, I work in a hospital. So I know the truth. Yes, hospitals learn to treat the COVID patients in better and better ways and save more and more lives. But what should be the goal of medicine? is to keep you out of a hospital. And what Fauci failed to do, and the public health system failed to do, was to give the highest priority to keep Americans out of hospitals. Where were people dying mostly? They were dying in hospitals or, unfortunately, in nursing homes. But again, we have to make these protocols, these ivermectins and hydroxys, they should have been made available to people in nursing homes, okay? Would have been wonderful. You gotta, I'm data oriented, okay, because of my academic background. And again, I recommend my book. My book is aimed at ordinary people. It's easy reading. It's not a big book, but it's filled with data. And I believe in following the data, following the science. So I really go out of my way to give you all this amazing data in the book that should convince any objective person who hasn't been, fed and bought into the propaganda. Let's call it propaganda from the mainstream media, propaganda from Fauci and the government. It's all propaganda. And what I'm trying to do in my book is nullify the effects of all that propaganda, which was against initially hydroxy, and a lot of it now is against ivermectin, against everything that I think works. Okay, so it's all about not just corruption, but also propaganda that comes from the mainstream media and still comes from the government and still comes from the major medical societies and even universities. Okay, you still have a lot of these academics, and remember, a lot of these academics you see on TV shows that are still praising Fauci and lockdowns and vaccines. All these academics, $3 or $4 billion a year coming from Fauci's NIH group, supporting the research of all of these academics. Okay, that's an awful lot of money. Believe me, I have spoken to some of these academics. In privacy, they will tell you the truth. They are not going to go public talking against the government or what Fauci advocates. Okay, there's too much money involved. So it's not just big pharma. Yes, they're going to make billions, but the academic world, the research world out there, it's also billions of dollars coming from Fauci and NIH, which is controlling what they're saying publicly, what they're willing to advocate. It's just, again, money corruption, but it's a different area of corruption. It's financial from NIH versus financial in terms of big pharma.
Yeah, I had Dr. David Martin on the show, and he has a company where they would keep up with like the markets, and they had all these algorithms they would keep up with, and he saw an increase in their, I think it was early 2000s, of a interest in coronaviruses, and people were patenting testing and all, patenting the different strains of the virus, all this stuff. And then he ended up eventually being in the Pandemic documentary and being interviewed, because now he could kind of foresee, or he saw afterwards, he could reflect on like why that was all happening. But so there, like you said, there's tons of money to be made in all this. A question I get from time to time, but I don't actually know the answer to, is who gets the money? Like who's really benefiting and all, giving out all these vaccines? Like who's paying for that? Because I mean, obviously when people can go anywhere and get a vaccine, like who's paying for that? All the testing, who's paying for that? And who's benefiting from all this stuff? Because we see it as like free services, but obviously there's some financial benefits in all this stuff.
Yeah, it's the government. You got to remember that what Trump did, and to his credit, he just spent a zillion federal dollars to buy in advance, to buy the vaccines from actually three companies or more. Actually, he put the federal money up front, which was an unusual thing to do. And the reason why we have the vaccines today is because Trump put up billions. It was billions of federal dollars, our tax dollars, to buy the vaccines in advance of their development, in advance of their regulatory approval. So when you get a vaccine now, like I did. I didn't pay anything, okay, when I'm on Medicare, but the government is paying, has already paid. So virtually nobody in the US has to pay for a vaccine. They shouldn't be paying, actually. It should all be free at this point. Now, that's different when you go to other countries. You know, it's very interesting. Canada, our neighbor, they're not, people up in Canada are not easily getting vaccines because, and most of, go to Europe also. Other countries did not do what Trump did. They didn't buy the vaccines in advance. Now, some countries, Israel is a good example of very successful sort of pandemic management. But again, Israel is willing to spend government money, okay, to get vaccine out to a high percent of their population. Um, so it is all about the money, but it's not a free ride. It was our tax dollars. And the reason why all of us, you know, can go to CVS now or go to all kinds of places now. I got mine through the Johns Hopkins system, and we don't pay. Of course, we don't pay now because we paid with our tax dollars in advance, and we'll be paying in the future because of our national debt. You know, we we are headed for some economic disasters because we owe so much money. And who's holding our debt? So much of it is owned by China. So, you know, China is, they gained, it's interesting that the latest data shows that of all the countries in the world, only China has had a lot of economic growth in 2020 during the big year of the pandemic. So China not only gave the virus to the world, let it spread throughout the world, but made out economically, financially from the pandemic, okay? It's an amazing story. When the history of this is written, it may take 10 or 20 years. It will, if it's written honestly, all of this craziness and corruption and wrong-headed decisions made by governments, particularly public health aspects of government, the history will be amazing. And I think Fauci eventually will go down in history as, you know, what he should go down as, someone who got it wrong and refuses to, although he corrects his position every now and then, flip-flops now and then, he can't move away from what he has mostly obligated his money to, and that is vaccines and expensive drugs like remdesivir, okay? So, you know, but eventually I've seen a lot of surveys, I don't know whether you've seen them, that roughly 70% of the American public no longer trust Fauci. I think that's great. You know, I published lots of articles over a period of 4 to 6 months going after Fauci. And I think a lot of, and even some of the news shows on Fox News and what Dennis Prager has said, I think there are some voices out there, not in the mainstream media, but there are some voices out there which has shown that you can no longer trust what Fauci says and what he advocates, what he justifies in terms of following the science. Every time I hear him use the phrase, follow the science, or any politician says, follow the science, you know, your ears should light up because you know you're hearing BS. You know you're hearing this from people who are not following the science.
Yeah, I mean, he does flip flop a lot. I mean, even the PCR test, there was a show I listened to that had a clip of him talking about like how they should lower the cycles and you can get false positives by 35 or more cycles. And it's like, you know, you're only saying this now. Like it's just he goes back and forth, and that's why it's obvious that people's dislike of Trump or just Republicans in general or conservatives is what's motivating people's just love for Fauci, because it's not based on what he's saying. I mean, he changes his opinion from day to day. Like you said, he's on 60 Minutes telling them, yeah, no need to wear a mask. It's ridiculous for wearing a mask. The average person doesn't need to wear a mask. The person interviewing him even doubles down and says, are you sure? There's a lot of people listening. And he says the same thing. And then he gives this whole bullshit excuse about, oh, well, it's because I didn't want the supplies to run out. Well, if you thought covering your face would actually save lives, then couldn't you tell people, hey, get a rag, cut some sleeves off a shirt, find something, and just cover your face when you leave the house. Don't go buy all the supplies, and you'll save lives. Like, you could have easily done that. He didn't even entertain that because he basically was telling the truth, I think, at the time. And then the whole mask thing, just like everything else we've discussed, became political, where it was like, you were for masks or anti-masks based on, your political team. And it wasn't about the science of masks or the lack of science of masks. I've made the argument that even if you find studies that you can refer to, a lot of it's in a hospital or medical setting where you're using disposable masks, one-time use masks. They're clean. You get them out of a box, you put them on, you take them off. Well, guess what the majority of Americans are doing with masks? They're throwing them in their car. They're keeping them in their pocket next to their cell phone and
Absolutely.
keys, things that are full of germs and are dirty. They're not washing them often. They're not reusing or they're not using one-time use masks. They're taking masks that are getting germs and getting dirty, and then you're putting it right on your face. You're breathing in carbon dioxide, which isn't
Yes.
good for you. And so these are all things that people don't even take in consideration because it became such a political thing. I mean, Del Bigtree, who's been banned off YouTube, he was a part of his nonprofit organization, ICANN, was the group that actually, so in Massachusetts where I live, they made it mandatory for kids to get the flu vaccine before going back to school, which was ridiculous because one, according to the numbers, which are flawed, the flu disappeared. So we don't even need the flu vaccine, but they made it mandatory for the flu vaccine. ICANN went to court, sued the state, and then removed that. So this is the same guy that is too dangerous to be on YouTube, but yet his nonprofit organization does some good and gets wins in court and gets the flu vaccine removed from it being mandatory for kids to go back to school. And I mean, stuff like that just proves that it's vaccine pushing, and it's not about science. It's not about anything else besides making profit. So hopefully we can make you some profit by selling some books, because I think your book is very important. And I went on Amazon. I think I saw that maybe there's another place to get it, but I saw
it's available everywhere, pretty much.
Everywhere. Okay.
Yeah. But I like Amazon because I can follow the data and see how the book is doing, and it's very cheap. If a lot of people, what's that system they use? Kindle. If you're a Kindle user, many people can get it for free, or only pay $5. So it's very cheap if you're a Kindle person. But the price of the book itself is relatively cheap. I forget, it's less than $20. But I like Amazon because they put up some reviews, and they have good reviews now, and I can follow the data. But it's available at Barnes and Noble. I've looked it up. It's available pretty much everywhere where books are sold. Okay, and so obviously the reason I did the book. It cost me money. I didn't do it to make money. I did it because I felt a moral obligation to not only inform Americans, but to counteract the propaganda that was creating misinformation and disinformation and leading Americans down the wrong road. So I wrote the book to save lives. I mean, if you ask me my primary goal, it's to save lives. And there are only 4 sort of chapters in the book. It's an easy book to read. I've had people tell me they read it in one night. That's great. I meant it to be a quick and easy read, but it is loaded with data. And the last part of the book is developing your own strategy. How do you stay safe? And the things you can do. But I also give the data that shows that if you look at what the best doctors have said from their own clinical work, that 70 to 80% of COVID deaths can be prevented by following the protocols that these doctors like Zelenko have been using now for a year, actually, okay? But there's not a lot of these doctors, okay? But what I do is I give all the websites in the book you can go to these great websites that can't be banned because they're just good websites, okay? And they give you the data from all over the world. And you can see data that is absolutely mind-boggling. Anyone who, and I summarize this data, but I also give the websites in the book so people can go themselves and because the data keeps changing. More data keeps coming in, especially from around the world. But the data is so consistent. It so shows that that the generics like ivermectin and hydroxychloroquine, wherever they have been used, and you can get data, they show that they really work. And that's what I'm trying to do. I'm trying to inform. I'm an old professor originally. I'm trying to inform and educate people so that they can save their own lives and not go through it's not just about dying from COVID. There's a lot of people who get COVID and they will be suffering various medical conditions probably for the rest of their life. It's the long-term effects of getting COVID. Even if COVID has not put you in the hospital, you can still have long-term effects once you got the disease and it wasn't treated very well, okay? So this is going to be a health issue for many, many decades to come. But also, as I've said, all these lockdowns and school closings, they have themselves caused enormous health problems. The one thing I always like to point out about Fauci, he's not a public health official. He's not even trained in public health. A public health official, by definition, has a moral and legal requirement to look at both the positive and negative impacts of any public health action, okay? That's exactly what people like Fauci do not do because they're not legitimate public health officials. And where you see public health officials screwing up, as in New York, as in a bunch of other states, my God, Michigan, it's where you see public health officials that are awful people also, and that have not looked at the negative aspects of masking, of school closings, of shutting down businesses, of wrecking the economy. All these millions and millions of people that are out of work, all these hundreds of, over 100,000 small business, particularly restaurants, that are closed forever. Look at all the lives that have been destroyed. How can you be a legitimate public health official and not see the negative consequences of public health actions? So I have a very strong view, and I wish the media, they keep describing Fauci as somehow as a public health official. He's not a public health official. NIH is not a public health agency. Again, it's a research agency. He is a researcher by training, and he hasn't been a real clinician as a physician probably for decades. As you say, if you subscribe to Google has this news service, which is free, and so I always have subscribed to Fauci. And if you get daily inputs, it's like every day what you see is Fauci is on a radio or TV show or doing some sort of press interview every day without exception. He's out there. So when is he doing research? When is he doing legitimate NIH work for his $440,000 a year or whatever it is? Okay? He's not. He's a propaganda guy. He's out there selling, what Big Pharma wants, what billions of dollars to be made. He's a globalist and he's a narcissist. He is a narcissist. He just lives in this wonderful world where he thinks everyone is appraising him, adores him, and the media sustains this on a daily basis. The mainstream media, again, not the alternative media. I had a lot of websites that were publishing my articles, but these are websites, again, not the big, mainstream websites. But I was getting the word out, honestly, about Fauci. And my book, some people said, people are still in the mainstream media. I can't get any media attention to my book. And I think it's because I've gone after Fauci in an explicit way. And the subtitle of the book, has Fauci in it. So I'm probably unable to get that, big time media attention, because the media is still, going to stay away from people like me who want to tell the truth about the consequences of what Fauci has done, what he has promoted, and what he still advocates. And that's a hell of a story. And it's I always tell people the true story that I try to tell in my book. I think my book also, it tells a story. And it's a story about a total corruption and the misdeeds of our public health system, our political system. And that's a story that needs to be heard and needs to be understood by more and more Americans. So, that's why I'm trying to promote the book. Again, it's an easy read. I didn't write it for professionals. I wrote it for ordinary people. And many people have come back and said to me, yeah, this is an easy read. They can read it in one night. And, they'll mark it up a lot because of all the data that's in there. But I appreciate being on your show to help get the true story out. And it's a job, as you know, because you're in alternative media, to get the truth out. And that's what this is all about. Can we get the truth out about vaccines, about these early action protocols by and the loss of medical freedom? People should be so upset. I have a regular physician that I go to, okay? My primary care physician, who I love. I like this guy, okay? And I said to him, will you consider prescribing for me hydroxychloroquine? I did this some months ago. He said, no, he couldn't do that. He can't do that. We have put handcuffs on physicians because of what the federal agencies have done and said, and because medical societies and all of these hospital systems, most physicians, a lot of people don't know the truth here. Most physicians in the United States are no longer what we call independent physicians. The vast majority of doctors in the United States belong to a hospital system or some sort of large corporate system. Those big systems that most doctors belong to, okay, they follow strictly what the government says and what major medical societies say. That's why I belong to the only two what I call medical societies, is America's Frontline Doctors and the Association of American Physicians and Surgeons. Why those two groups? Why did I join these two? And I try to promote them in my book, because those two groups have independent physicians as members, okay? These are the doctors in the United States that are willing to take risk, that are willing to be like Dr. Zelenko, and I love George Fareed in California. These are the independent physicians having the courage to do what is good medicine. They're still practicing using their medical freedom, but that's not true for the majority of doctors in the United States, because they belong to big corporate or hospital systems that won't allow them to use these protocols that I'm advocating and that Zelenko first pioneered, okay? So this is another, the medical world that we live in is very complicated. And again, to understand that most doctors are not free to use their best judgment anymore, the best way to deal with the pandemic, to keep their patients out of hospitals. Too many of ordinary physicians, what are they focused on? They're focused on good hospital care. They're focused on vaccines. That's the wrong focus. The focus should be early action, keeping people safe and out of hospitals. They don't need to use, $5,000 drugs like remdesivir in a hospital. And for most Americans, I want them to think seriously about whether they need to take the vaccines, whether that's the best strategy in terms of prevention. And, more and more data is coming out all the time. And the right phrase to use is that these are experimental vaccines. Is there risk involved? I have some stuff in the last chapter of my book from an official government website that all these details about the things you could worry about if you take the vaccine, the unknowns, the things they haven't researched, the things that they don't have answers to about taking the vaccine. So yes, I took the vaccine, but I think I'm almost the exception because of my age and my health condition. But I'm certainly talking up that other people should give serious thought to alternatives to the vaccine. I'm not an anti-vaccine person per se, but I think good judgment is needed. And unfortunately, to have that, to be able to make a good judgment, you have to be better informed. And so that's the purpose of my book, Pandemic, Blunder. Can I hold it up again? I sort of had something to do with the design of the cover. So, I think it's an easy read and worthwhile. And it's the only book out there that I tell a lot of things that nobody has ever seen before. I had a conversation just last night with somebody who's very smart and very educated. And yet, most people don't know that there's a legal requirement that was set in law some years ago. And it's called, the phrase used is real world experience. If you can look it up. It's called real world experience. It's in a federal law. And people like Fauci and others in these federal agencies, FDA particularly, are supposed to sanction and use and respect what's called real world experience. So that means the way you prove that a drug is okay is not merely through randomized clinical trials, which are very expensive and take a long time. You're allowed to come to judgments that a drug is safe and effective based on the concept of real world experience. I think my book is the only one out there that goes into this and to try to educate people that this was in a federal law, that professionals, particularly in federal agencies and academics, are supposed to respect real world experience, so that when we get doctors coming in like Zelenko and George Fareed in California and others around the country, they have clinical data, what they call observational data, based on their clinical work with patients, real patients, and they have real world data, okay? That data, and I have a lot in my book about this, that some very senior smart people have said, you can respect the judge efficacy and safety, not through expensive randomized clinical trials, but through other ways of getting data, what they call observational data, basically, clinical data. And one of the great failures of our government system and public health system is they haven't given enough respect to clinical data, not these fancy trials that the drug companies are supposed to do. And by the way, which have not been done for the vaccines. The hypocrisy here is that Fauci claimed that no randomized clinical trials had been done for hydroxychloroquine. Now he's not willing to say publicly, neither have they been done for the vaccines. Isn't that an amazing hypocrisy? He went after hydroxy because of the lack of randomized clinical trials where you have a placebo and usually thousands of people enrolled. They are very expensive and take a few years to do. He blamed the lack of those for justifying condemning hydroxy and even ivermectin now. And yet, he's not honest enough to tell the public that those same kinds of randomized clinical trials that go on for several years, involving thousands and thousands of people, were not done for the vaccines. How many people know that? I don't think many people know that. I don't think the media has ever asked Fauci. Nobody in the mainstream media will ask him a good, tough question like that. Okay? How do you justify what hasn't been done for vaccines? How do you justify the way you went after hydroxy? He's not consistent. He's one of these people, again, he's very hypocritical. He's not consistent. And when he says follow the science, he's about as deceitful as you can get, okay? He doesn't follow the science. Following the science, as in real world experience, which has legal meaning, okay? You follow the science through what we call observational studies or clinical data. And that's when I deal with doctors around the country, and I'm involved in a couple of different groups with physicians, they're so angry and frustrated. The good doctors, the Zelenko, the George Fareed, and McCullough, and all these other good doctors. Not a lot of them. Harvey Reich from Yale, very good. But they're as angry and frustrated as you can imagine. Because, again, they know the truth. And it's not coming from the government, and it's not coming from Fauci. But by the way, even a lot of the doctors that I adore and praise, they're also not too willing to go too public against Fauci. To go against Fauci in a public way is, for a lot of people, that's, a death penalty. That's something you're afraid of what they did to Trump, will happen to you. Okay, so people are still afraid of telling the truth if it involves, a truth that is not coming from Fauci. And what people don't understand, I worked in the federal system, and part of my background, I don't think I didn't make it clear. I had a very senior position in the federal system for the US Congress, okay? So I know that the government system, how it works, really know how it works, okay? And what people don't understand, when Fauci got all of the power through what the media was doing for him, he overrules. He has power over the head of FDA and CDC. Okay, so he has such enormous bureaucratic power. Developed what? He's been in the position, I think, for close to 50 years. Okay, the reason he makes so much money. Okay, he is the ultimate bureaucrat. If they gave out a Nobel Prize for being a great bureaucrat, he would get the Nobel Prize. Okay, he is the epitome of the excellent bureaucrat who knows how to get power and to wield power. And so you can't trust in the independent stuff coming out of CDC or FDA, not if it contradicts what Fauci advocates. You never see that happening anymore, okay? CDC and FDA are not willing to contradict what Fauci says is true. What Fauci says is following the science. So we have impotent federal agencies because he wields so much power. And he didn't lose the power when Biden becomes president. The most amusing thing for people like me, Biden actually elevates Fauci in some sense. He gives him an even higher title. So, which is kind of amazing, really, when you think about it, that this could happen.
Yeah, no, I think you have a very important book. I think just having a book and somebody like yourself who focuses a lot on specifically Dr. Fauci, I think is very important because that's the face of the medical world and the science world at the moment. And
right.
so for somebody to dissect who he really is, what's his real motivations and those type of things, I think is very important. I have a lot of friends in the alternative media community throughout the years of doing this, so I'm going to help you out in regards to giving you a bunch of shows if you're interested in doing some more
Oh, absolutely.
I'll get you tons of contact information with tons of shows. I'd be more than happy to have you on and promote your book. So I'll help you out with that. I mean, like I'm with you. Like I don't do this for money either. It's actually, my wife would probably rather me spend more time doing something that made us money, but it's it's something like you said, it's morally something I have to do. I think this is important conversations, and they're getting harder and harder for people to find these alternative narratives and these alternative perspectives. So we're all doing our part in just getting people information. And I agree with you 100% too in regards to not being a anti-vaxxer per se, because I don't consider myself an anti-vaxxer. I'm pro information. I'm pro freedom.
Exactly.
But you have to have all the information to make that decision on what risk is greater. And my biggest issue with this whole vaccine debate is the fact that people are getting force-fed one side of the argument,
Exactly.
and they're being the other side of the argument's being completely suppressed, or they're being convinced that it's already been debunked and somebody's already done the research. It's not worth your time looking into it. Or if they do want to look into it, it's completely impossible to even find a good source of information. So it's I'm for giving everybody the information. And if you decide like yourself, like, hey, you know what, like the risk of taking the vaccine is less than the risk of me being exposed to a virus or a disease, then that's okay. I don't have a problem with that. I just want people to have all the information so they can make a good decision based on both sides of the argument and not just one.
And can I just add one thing?
Yeah.
One other reason I took the vaccine was to get back my personal freedom. In other words, I used to travel a lot. before last year, I would take 3 or 4 foreign trips a year. I've traveled all over the world. Okay, I'm older, I'm fairly affluent. I love to travel, and I like my personal freedom. I wanted to go out and be able to go to restaurants and shopping and not worry, not have this fear. Fear is what's being propagated by the political system. So that was another reason for me to take the vaccine at my age with my health condition. I wanted to regain my personal freedom. And I hadn't said that before. But it wasn't just to play safe in terms of not dying from the disease. It was I wanted to feel good about, I go out now 3 or 4 times a week. I go shopping. I'm going to go back to restaurants. And where I live, unfortunately, I live in Maryland, they still haven't opened up. I can't believe this. Most restaurants you still can't get into. It's a disaster in terms of the loss of constitutional freedoms, which is a whole nother aspect of what Fauci and his people have done. They've destroyed constitutional freedoms. And I'm a big believer in that. So for me to take the vaccine and for other people like me, you want to regain. I've heard this so many times from people who just got the vaccine, older people. Now they go back to shopping. They don't order their foods delivered, their groceries delivered. They can go into their Safeways and Costco's and et cetera, and feel safe because they took the vaccine. Okay, I relate to that. Feeling good enough because you took the vaccine. But I also felt good enough. I was still doing shopping before I got the vaccines because I was taking my daily protocol of zinc, quercetin, vitamin D, and vitamin C, which again is in my book. You can take that protocol, no prescription necessary. And I've been doing that for at least 4 months, maybe 5 months. So I was still, going out more than most people my age probably. But that was another reason I just wanted to bring up why some people, that's an argument for older people, particularly people in their 70s, 80s, 90s, take the vaccine if you want to regain your freedom of choice, your freedom of movement.
Well, but isn't I've heard people say that, but because it doesn't actually stop you from getting it.
Yes, I know.
How I just help me understand like the logic. Is it more of the placebo effect that just makes you feel safer?
No, the logic is this. Well, first off, most people don't know, they're not informed that if you get the vaccine, you can still get the virus. It could still be in your body. They don't know that, okay, first off. But even if you know that, then you believe, well, if I have the vaccine, I still won't get deathly ill from it, and I won't die from it if I've taken the vaccine. And that's enough of an emotional feeling to justify a lot of, again, mostly elderly people. And I live where I live, there are lots of very elderly people. Uh, so that's enough of a logical reason to get the vaccine and then to go out into the real world again and enjoy life more, okay? Next week, I think our restaurants will be more open. We will go out to eat once again in restaurants. Uh, I'm already planning a trip to Florida. I already made a reservation. I look forward. I used to go to Florida frequently. I like South Beach in Florida. It's a great place, wonderful beach. Uh, so travel again. And by the way, the data, one of the great pieces of scientific data is that people flying on airplanes don't get the virus. And the reason they don't get the virus is because the air is so well purified and clean in airplanes, not just because they're wearing the mask. It's because of the air systems in airplanes that research has shown. That's one of the safest places to be is on an airplane, okay? So, but
Yeah,
travel
but
is,
isn't it weird that on an airplane you have, we actually just went to Florida to leave communist China, also known as Massachusetts, for a little bit, and my wife has some family in Florida, so we went down there, and it's to me, isn't it like a little silly that we're in a plane where there's people in front of me, multiple people in
right.
front of me, on the side of me, behind me, all this stuff. But the second you get off the plane, you got to be 6 feet away.
Yes,
And I'm like,
yes,
I've just been on the plane for 3 hours with these people, and
exactly.
right, rubbing elbows, and yeah, to me, it just, none of it makes any logical sense. I mean, wearing a mask to your table at a restaurant, and then
Exactly.
and then you sit down and you're fine, and or like in Massachusetts, they had a curfew at 9 or 9:30.
Crazy.
Yeah, it made no, and the worst part is that they weren't even defending it with science anymore. I mean, it was initially, at least they would kind of attempt to give you some scientific justification to why they were enforcing these stupid rules and regulations. But after a while, they're just like, yeah, we're gonna make a curfew at 9:30 again. Oh yeah, we're gonna go back and the 25% capacity at restaurants. We're gonna go, and they just wouldn't even give you any what I would call bullshit science, because none of it was actually good science. And so it just, people have to be wary of all this. To me, it blows my mind when people look at all this and they can't see that things aren't making sense, and are still brainwashed by the power of mainstream media.
Yeah,
But unfortunately,
yes.
a lot of people still watch the news and think
Yeah.
because it's on CNN or whatever they're watching, that it must be accurate, and it must be, but you look at the way they sell us wars, you look at the way that they lie about plenty of other things, and this is no different. So for people listening who want to keep up with your work, keep any social media platforms you're on, or any other work that you might be working on, how do they keep up with you?
Well, I don't use social media. I never have. And I just made a decision. I'm not going to get involved because I'm probably going to get nailed because I'm too outspoken and my views are too radical. So that I wouldn't even stand a chance. But I have never been into social media. So getting my book right now, and I do podcasts. This is the fourth podcast I've done, and the last two were just tremendous. I think you saw one with Jack that I did. That was a tremendous one. And then I did a great one that's also, I give people the link to. There's a group called the Heartland Institute, which is in the Midwest somewhere. And they did a podcast, which was also terrific. And what's happened, the woman at that organization is now my big advocate, and she's trying to get me more exposure. Jack got me to you, and so Jack has been working to get me more exposure. But right now, it's my book and doing podcasts. I do recognize that, and the podcasts that I'm doing are not mainstream media podcasts. I can't get on that. I can't even get on, what's amazing to me, I can't even get on Fox News shows, which are interesting. I don't know whether you ever watch Laura Ingraham or Tucker, those shows, because they actually have told a lot of truth about home remedies and they've also gone after Fauci, but for whatever reason that I can't fathom, I can't get any of those shows to even talk about my book or to interview me on the show. So right now, it's podcasts and and the book basically. But I personally don't want to start trying. I'm too old and I have a very negative view about social media. I'm just from an old generation, but also that my views are just too radical. I don't think I would stand a chance, and I don't have the resources. I mean, I was so impressed on your website that you are so. I mean, you're in this younger generation that you have the technological know-how to use what's available on the internet and to use social media, to use alternative. I couldn't believe, I was so impressed by your website uh, and what you're able to do. That's far beyond my capabilities. I don't have, and I'm trying to work with organizations, okay? I'm involved with a couple of organizations, and a new one has approached me. So I will work with organizations who agree with my general views and who I can help, uh, work with them to advance their cause. So that's but my first priority right now is it's just if people would read the book, I know we would change minds and we would offset the very negative impact of all the goddamn propaganda that has come from the mainstream media and from Fauci. Every day, I'm old enough, never underestimate the power of the mainstream media because it's there flooding, the radio and the network shows and the cable shows. The mainstream media is just so powerful. We never should underestimate the enemy, okay? I learned that long ago. I'm old enough, I've been involved in different movements in my lifetime, usually radical movements, okay? And and so that's the kind of person I've always been, okay? Um, I spent 10 years, I actually ran a consulting company, and I helped citizen groups all over the nation fight the government to clean up toxic waste sites. I was famous for this for a number of years. And I help people all over the country because that's just in my nature, is that I saw government failing to protect the health of people that were living near toxic waste sites, okay? So I developed a consulting practice where I went all over the country. I help people really fight the government and large corporations. And I worked for big legal firms who were fighting big corporations as an expert witness. And just as an example, I got 2 African American communities, 2, totally relocated because they were living at government expense, relocated the communities away from the toxic waste sites they were living near because people were dying from dioxin poisoning, okay? I closed down incinerators. I did a lot of things over a decade to help people. That was my big fight for a decade, okay? And I was pretty successful at it, actually, very successful. But this is a new fight. I didn't think I'd have another fight left in me at my age, but when this pandemic came along and I began to learn the science, okay? Because I could read, again, I'm one of the few people, I can read all the journal articles. I understand them. I have enough science education, medical education to read it all, to understand it, okay? And so, that's where I am now, fighting the good cause. But again, I didn't think I'd write it. I already had written 3 or 4 nonfiction books. So I have an experience in writing books, but I didn't think I'd do it again, but I did it again because I think the cause is so important. And obviously you do also. So we're together that this is a morally important cause to better inform the public. It's all about choice, as I like to say. It's giving more choice to doctors and more choice to ordinary Americans. Choice for both doctors and their patients, okay? this is what's so important. And this is what I'm fighting for, basically.
Yeah, absolutely. Yeah, I'm everywhere. I put my show everywhere because I'm like you. I'm radical. I like to explore radical ideas, and I know that I'm going to have issues on different platforms. So my stuff's all open source. I let people share it, post it anywhere they want, because the conversations are more important than me getting the traffic and getting the views and clicks on my specific
Right,
channels.
right.
So I just let people post wherever they want. But yeah, I mean, over and over again, you're seeing people banned. Just recently, friends of mine are getting kicked off. Ryan from Last American Vagabond, Whitney Webb, James Corbett, they're all having issues with Patreon. Is kicking them off. It's like it's just a matter of time before we're banned off Google, YouTube, literally everywhere. And even people who aren't banned, in many cases, they're shadow banned. They're not suggesting their videos. If you search for their videos, you can't find them as easily. So there's a lot going on, but that's why we need people like yourself and shows like this that are willing to have guests on like yourself that are to talk about these controversial, what the public or the mainstream media would call controversial issues.
Right.
I don't think they're controversial. I think they're just the other perspective.
Yep.
So yeah, and I'll help out any way I can. I'll give you, I'll hit up a lot of my friends, and I'll also give you tons of contact information for other great shows that have huge platforms that can help out in getting the word out. And like I said, there's not a whole lot of other guests that focus specifically on the stuff that your book focuses on. So let's get the word out, and any links that you would like in the show description. If there's any of your organizations that you deal with that you would like people to have access to the websites or whatever, send me anything that you want in the show description. I'll make sure to put obviously links to your book and any other organizations in the show descriptions.
Will do. I really appreciate this
Hey,
very much.
thanks, Joe. I really enjoyed the conversation. Keep up the great work, and I'm sure we'll stay in touch.
Thank you so much.
Thanks,
Thank you.
Joel. Enjoy the rest of your day. Take care.
You too. Thank you.
Thank you.